If you're preparing for the OET writing test, you need to make sure that you don't lose marks with silly grammar mistakes. Keep watching for the top grammar mistakes that OET candidates make and how you can avoid them. Hi there everyone and welcome to this OET video. My name is Grace. I'm an expert OET teacher and academic manager at Swoosh English. Now we all know that grammar can be challenging, especially when you are writing under exam conditions. Sometimes the pressure of being timed and being in an exam can cause you to forget grammar rules that you should know and end up making silly grammar mistakes. Now we want to avoid that, so in this video I'm going to talk about the 6 most common grammar mistakes that OET candidates make and then give you some tips and advice on how you can make sure that you avoid them. The first grammar mistake we're going to look at is run-on sentences. Take a look at this example sentence here. Miss Gray has a history of diabetes. She was prescribed insulin injections to manage her blood sugar levels. This sentence is incorrect. And the reason for that is that it combines 2 independent clauses. So the first clause, Miss Gray has a history of diabetes, with the second clause, she was prescribed insulin injections, but there's no proper punctuation or a use of a conjunction. Let's see how we would correct this sentence. So here you go, you can see that now we have joined the 2 clauses together with the conjunction and resulting in a correct sentence. So one of the best ways to avoid run-on sentences is to make sure that you know exactly how to use conjunctions, transition words, and also correct use of punctuation. So knowing punctuation rules, knowing the different conjunctions and their functions within a sentence is really going to help you avoid making this first grammar mistake. The next mistake we're looking at is comma splices. So take a look at this example. The physiotherapist conducted an assessment. Miss John has limited range of motion in her right shoulder. This is an example of a comma splice and it is incorrect. The reason for this is that it combines 2 independent clauses with only a comma. This is not a correct use of commas. So let's take a look at how we can make this sentence correct. The physiotherapist conducted an assessment which revealed that Miss John has limited range of motion in her right shoulder. So this sentence is correct because now those 2 independent clauses have been combined into a relative clause. Now, relative clauses are going to be really useful to you in OET writing, so I really do recommend that you polish up your skills and review how to use relative clauses, as it's really going to help you avoid making that kind of mistake with the comma splice. Next up, we have incorrect use of articles. Now, this is a really common problem that many people have, how to correctly use articles in the OET letter. Let's take a look at this example here. Physiotherapist assessed range of motion in his shoulder. Now we have 2 missing articles here. Let's look at the correct sentence. The physiotherapist assessed the range of motion in his shoulder. This is correct. Why? Well, the definite article there is needed before physiotherapist because it refers to a specific physiotherapist. Also, it's needed again before range of motion because we're referring to a specific assessment conducted on a specific body part. So make sure that you are familiar with the rules of using articles. One of the main reasons why people make this mistake in their OET letter is because they copy the information directly from the case notes without thinking about how it needs to be expressed in a proper grammatical sentence. So when you are transferring information from case notes to your letter, just think about what else is needed, especially articles, and just make sure that you don't fall into the trap of making that particular grammar mistake. Next, we have lack of parallel structure. Now, what exactly do we mean by this? Let's take a look at an example. The physiotherapist recommended swimming, doing yoga, and to go for walks to improve the patient's mobility. Can you spot the mistake in this sentence? Hopefully, you were able to spot that the verbs were not in the same form. So the first 2 recommendations are in the form of gerunds. We've got swimming and doing yoga, the gerund form. However, the third recommendation is an infinitive form, to go for walks. So this reflects a lack of parallel structure. We need those verbs to be in the same form. So the correct version would be swimming, doing yoga, and going for walks. Remember, after the verb recommend, we need to use the gerund, and all of those verbs need to be in the gerund form. So as you can see now, all three recommendations are in the same form, which maintains parallel structure and makes the sentence grammatically correct. Now, once again, a common reason for not maintaining parallel structure might be because you haven't copied the information correctly from the case notes into a grammatically correct sentence. So once again, don't just copy words directly from the notes. Keep in mind that you do need to transform the notes into proper grammatical sentences. Next, we have incorrect tenses, another really common problem in OET writing. Let's take a look at this example. Mr. Ford was admitted on the 14th of the 3rd, 21 and has received pain medication for 3 days. Now, you really need to be careful here because the use of that present perfect has received makes it sound like this was a recent event that started in the past and has continued up until now. So it makes it sound like this patient has just finished the 3-day course of pain medication. However, if we look at the date there, 2021, this is a completed event that happened in the past. So this is incorrect. So when you're referring to a completed event in the past, like a finished course of pain medication, you need to use the past simple. So the correct sentence would be, Mr. Ford was admitted and received pain medication for 3 days. It started and ended in the past. It's a completed event. This example here, Miss Glover made a full recovery and is now ready to be discharged. This isn't quite correct. Now, when we are referring to something that happened in the past and has relevance in the present, we need to use the present perfect. So this patient has made a full recovery. It's something that started in the past but has relevance to the present moment. She's now ready to be discharged. So the correct sentence would be, Miss Glover has made a full recovery and is now ready to be discharged. Now, the best thing you can do to improve your use of tenses in OET writing is to practice writing letters as much as you possibly can, and ideally get feedback from expert OET teachers. Another thing you can do, once you've written your letter, go through and identify all of the different tenses, and for each one, see if you can explain to yourself and justify why you used that particular tense. It will really help to improve your understanding of how to use tenses in your OET letter and hopefully become more accurate. The final grammar mistake I would like to talk about is not using passive voice. Let's take a look at an example. The surgeon performed the operation. Now, while this is not grammatically incorrect, it is not appropriate for our OET letter. The reason for this is because it's really not necessary to say who did the action. Remember, we use passive voice when the person doing the action is either already known or irrelevant. So, of course, the surgeon performed the operation. We don't need to be told that. It's already obvious. So a better sentence would be, the operation was performed. Now, by using passive voice, this helps us to focus on the action, the operation, rather than the person doing the action, the surgeon. So this maintains objectivity and clarity. Now, if you're not familiar with how to use passive voice, it is absolutely essential that you learn and you make sure that you're comfortable using it because you will almost definitely need it in your OET letter. If you're not sure how to use passive voice, you can get help from an expert OET teacher and ask them to give you feedback on this in your next practice letter. So now let's recap everything that we've talked about in this video and go over some top tips to make sure that you avoid those common grammatical mistakes. Firstly, ensure that you learn how to correctly use conjunctions, linking words, relative clauses, and punctuation to avoid run-on sentences and comma splices. Next, make sure that you do not copy information directly from the case notes. You need to transform this information into grammatically correct sentences. So for this reason, ensure that you are familiar with the use of articles and also parallel structure. Finally, it is absolutely essential that you are confident using a range of tenses appropriately and also passive voice to maintain clarity and accuracy in your OET letter. Now, if you are looking for extra help and support with your grammar to improve your performance in the OET writing test, we have a team of expert, experienced OET teachers ready and waiting to help you. Head on over to our website, www.swooshenglish.com, and take a look at our OET exam preparation courses. They've got everything that you need to improve your grammar as well as your writing, reading, listening, and speaking to make sure that you are ready for the exam and ready to get that high score that you need. So please do head on over to our website. Let Swoosh English help you pass your OET exam on the first or next attempt. Happy studying, everybody, and I will see you very soon for more OET videos.